Can Juvederm fix my hollow under eyes or lower eyelid surgery? I have hereditary hollow under eyes and smile lines from my mother, and I've tried everything to get rid of them. Lately, they've gotten darker, and it's becoming harder to cover with makeup. The same goes for my smile lines. I am wondering if Juvederm will give me a smooth, flat under eye and plump my cheeks so my smile lines will not be visible. My biggest problem with them is that I'm only 20, and I look at least 25 plus, and my makeup tends to sink into my smile lines really bad.
Thank you for your question. You're asking if Juvederm would be useful for filling in the hollows. And you describe a situation in your question with the photo you submitted that you're 20 years old and you feel like these are genetic or hereditary hollows and that the skin has gotten a little bit crinkled and that you are having trouble covering this up with makeup. And you feel like at the age of 20 you look at least like you're 25. Well, I can certainly give you some ideas based on how I approach patients like yourself in my practice and make a decision based on some of these concepts. So once you understand the framework and how someone like myself evaluates people like yourself in practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice for over 20 years in Manhattan and Long Island, helping people with rejuvenating their eyes and making their eyes look very good using a wide array of modalities, from minimally invasive such as skin products to procedures such as lasers as well as surgery, something that we do in our practice every day. So it is very important before you choose a particular product or a solution to define the problem that you're concerned about and understand what the potential options entail. To begin with, I would say that when someone who's young, like yourself, who's 20, comes to our office, I always have to frame everything in terms of whether or not it's worth the time and investment for someone who's younger to do procedures that can help genetic issues that require some maintenance. So let's begin with first the hereditary aspect of the relative hollowing. You look at the tear trough area, and the area does look a little bit hollow. And the area of the eyelid to cheek area can also look a little bit hollow. And there may be some natural genetic hereditary pigmentation and some lines. You didn't mention in your question whether or not there's a history of smoking, whether there's any issues with allergies and sinus problems. These are the kind of things we first learn about before we make recommendations in our practice. But coming up with the concept of what is the anatomy. So, technically, there's a relative deficit of volume, let's say in the tear trough and the eyelid to cheek junction. Generally for this area, we use a filler like Juvederm, but I prefer to use Restylane. Restylane is a little bit softer. I find in my hands it works better, and it can make an improvement. I often combine Restylane with platelet-rich plasma. Platelet-rich plasma is derived from your own blood and contains growth factors and elements of the blood that are required for wound healing. So what we have been able to do is successfully improve skin quality and get some long-term benefit from its combination with a hyaluronic acid filler. Now, that being said, I would caution you that you have to be prepared with these types of procedures. When you do something like this, you have to continuously do it if you want to maintain a certain look. Now, for some young people, especially in our area in New York City, where we have a lot of actors, we have a lot of people who are in front of cameras, they'll make the time investment. But I think that there's a different scenario when a person who's 20 comes with this issue as someone who's 40. Why? Because for the 40-year-old, it's a change. It's a shift of volume loss and other things. We deal with a lot of people who have these aging changes. But when it comes to someone younger, I just want you to be sure that you're willing to do this long term. Now, that being said, what's nice about these modalities is that they aren't permanent. You can try it, you can see if you like it, you see if it's worthwhile for you, and decide to make this part of your approach to helping yourself look better. But again, I would be cautious about someone who's very young like yourself engaging in this type of correction, because where is the time, and often the resources can be somewhat challenged. In addition, you have to understand that whenever you have a procedure, even if it's done with minimal trauma, with blunt cannulas, which is a technique of using cannulas that minimize bruising to fill the tear trough and to do these things, there's going to be some swelling. There's still a potential for bruising, and you have to factor that into your life. So, from the perspective of skincare, you might have some options where you might want to try the skincare option of topical creams. In our practice, we have our own skincare line, and we help people customize what might be a good solution for basically the epidermal to the superficial or the papillary dermal levels of the skin. But we could still do some create benefits such as improving skin quality and skin color or discolorations, irregularities with topicals, but it takes a little bit of time as opposed to doing something with like a laser. So learn more about your options. Don't just jump in and do something, but learn about this. And again, of course, there is still an option of not pursuing it beyond the initial experience, because the materials are temporary, whether it's Juvederm, Restylane, or any injectable filler. And if you don't feel like you want to do this at this point in your life, you can wait till much later. So I hope that was helpful. I wish you the best of luck, and thank you for your question.